Hello, ladies and gentlemen. Today we're going to be talking about specifically on what's going on in the overall happening in Europe and kind of what type of the deals that they're doing and with the whole transgender thing and kind of the fears of being moving ahead. Now, if we actually do go into further research, we end up starting to understand that the whole gender thing is very harmful to kids, a very irreversible effects, and completely trying to ignore actual typical biology. And we're also kind of starting to maybe understand that it's more of an experiment on children rather than actual being into the medical field. And of course, the people on the far left are going to go after people that try to point this out, calling you transphobe, etc., and it becomes a huge problem in this type of era. Now, I also recommend a video of being from Jordan Peterson with one of the women that wrote a book that was talking about how what's going on in the transgender community, specifically what's happening to kids. That women are actually more targeted to being to be transgender than men are, although men are being recruited. And part of the reason why this is what I also believe is that women are more known to be social people, and they're more likely to go with the social norms, which I would also believe is more headed by women because they are the ones that set the social standard and they follow that through. Most men don't normally do this. I know a lot of my friends that don't really want to follow, that are men that want to follow this social trend, but women tend to be the ones that go to this more social trend. And if that's the social trend, that's the social status which women go to for that to be recognized, etc. They go to that, and that's the reason why there are probably more women that are being more indoctrinated into this type of philosophy, which is having a horrible damage to women in particular. So we also have that's been going on. Another thing as well is that she opens up more of the door what's been going on into these nefarious type of deals, and I highly recommend it. I'll have it in the description below so you guys get to see exactly what's going on. What we have here in this article: Tavistock Gender Clinic forced to shut down over safety fears. I don't know why you have gender forced to shut over safety. I don't understand. They should just put shut down. The NHS is shutting down its gender identity clinic for children after a review found that it failed vulnerable under 18s. The gender identity service at Tavistock and Portman NHS Foundation Trust has been ordered to close by next spring. It will be replaced by regional centers at existing children's hospitals, offering more holistic care with strong links to mental health services. Tavistock Gender Identity Development Services, GIDS, clinic has been accused of rushing children into life-altering treatment on puberty blockers, which you've also discovered that puberty blockers also sterilize people. So, if you are going to get puberty blockers, you should probably well know that you are most likely probably going to be sterilized. They use these type of puberty blockers on sex criminals and stuff like that, so they can stop, abusing people. So, so there you have it. The pediatrician Dr. Hilary Cass, who is leading a review of the service, issued a series of recommendations today for a radical overhaul of how the NHS treats young people who are questioning their gender identity. She found that the Tavistock Clinic was not a safe or viable long-term option, and that other mental issues were overshadowed when gender was raised by children referred to the clinic. Well, we've been saying for a long time that the typical gender dysphoria is more of a mental issue than any other type of issue. There's also statistics showing that when they do transition, there is not really much of a benefit. Now, so I would say we would have to more treat them in the mental type of capacity rather than in the actual physical capacity. So that's the way we do it. I mean, it's also the same thing when we have schizophrenics and stuff like that, where it's not physical what they are saying, but it's more a mental, and we have to treat them more of a mental rather than doing the physical. And see what happens. We haven't had enough studies or anything that shows that this can be fixed, because the far left have taken this narrative and pushed it far into trying to make it a cultural thing, and that's just not seems to be reality. Cass, former president of the Royal College of Pediatrics Child Health, has said the existing model of a sole provider for gender services should be scrapped as it failed to meet the holistic needs of distressed and vulnerable teenagers. She said Tavistock should be replaced by regional centers with an appropriate multi-professional workforce to enable them to provide an integrated model of care that manages the holistic needs of this population. amid concerns that the clinic fails to take into account wider health problems before putting children on puberty blockers. Cass added, staff should maintain a broad clinical perspective in order to be aimed at the care of children and young people with gender uncertainty within a broader child and adolescent health context. NHS England, which commissioned a Cass review, the service in September 2020 says it will implement her recommendations in full and decommission the Tavistock clinic. It has announced the launch of 2 clinics for children with gender dysphoria by next spring, which will bring together multiple doctors from a broad range of specialties. The first in London will be based at a Great Ormond Street Hospital and receive specialist mental health support from the South London and Maudsley NHS Foundation Trust. The second in the Northwest will be led by a partnership between Aldi Hay Children's NHS Foundation Trust in Liverpool and the Royal Manchester Children's Hospital. Cass said these clinics must have established academic and education functions to monitor evidence on children who are put on hormone therapy. The Tavistock clinic failed to collect sufficient data on the impact of puberty blockers in under 16s. She said there was insufficient evidence for her to make any firm recommendations around their routine use. Cass told the NHS to enroll young people being considered for hormone treatment into a formal research protocol with adequate follow-up into adulthood, with more immediate focus on the questionings regarding puberty blockers. I think puberty blockers should be specifically more in the lines of the realm of, I would say, vasectomies and pretty much sterilization for you not to have kids around that age, probably in the 30s or higher. Because here's the thing, it's a very life-altering thing. Things that it will pretty much cause irreparable damage to your body and a good chance of sterilizing you. So I think that these puberty blockers should be put on the same standards as, guys who want to get vasectomies at an early age and women want to get hysterectomies and all these other things that would prevent them to have children, and put them at the same level as that. If we do that, it would be fine. First, we have to really tackle the issue on the far left going after children. That's one thing we have to really change in our culture and quickly. So that's another thing. Also, at this time as well, is that we'll have to focus more on the more issues of making puberty blockers at a way later age. Because you have to remember, the frontal lobe cortex of the brain does not actually fully develop until at least the age of 25. And until that fully develops and your decision making and everything is, pretty much at a full standard, then you should have pushed some huge decision making onto some other things here. So that being said, it should be pushed back further until whatever. I already know that I even at the age of 29, I still don't really want to have kids. So that being said, they would probably still having to ask me to wait before I would have given a vasectomy. So I still think that they should be on the same level as that. That's all I'm really saying. For kids, there should not even be a decision making at all. The NHS said it would launch clinical trials in partnership with the National Institute for Health and Care Research to follow children on puberty blockers into adulthood. This would ensure that there is greater transparency for children and their parents' cares around the certain clinical benefits and longer-term health impacts surrounding their use, a spokesman said. Exactly. I also think that there's not enough. What the clinics do and what the far left do or don't really want the parents to be involved. Because one, if the parents are involved, they start to understand that if they get involved, then the parents will most likely say no. And two, they're doing behind people's backs because they know that it's technically wrong and people don't want this being exposed. So, they don't really expose or tell these kids or anybody on the actual negative side effects on what the transition will do, on how bad it is, the actual issues that are happening, and how difficult the surgeries are and how bad it actually becomes. So until this is actually let known to people, it's just insanity. So these surgeries are honestly, I would say, experiments. The clinic has been overwhelmed by a sudden increase in referrals, particularly among young girls and children on the autism spectrum. Last year, it received more than 5,000 referrals compared with 250 a decade ago. Cass's final report will be published next year. Her interim review, published in March, found that the service had developed without clear rules and that there was clinic and lottery, which rely on varying approaches to treatment. She found there was a lack of agreement and, in many instances, a lack of just open discussion about whether unhappiness with gender in adolescence was permanent or temporary. However, last year, the court appealed to overturn a ruling made by the High Court that children under 16 were unlikely to be able to give informed consent to receiving puberty blockers, as they should. The case was brought up against the Tavistock and Portman Trust by Cara Bell, 24, who began talking puberty blockers when she was 16 to transition to male before detransitioning. And now that we have this in the way, we also have this as well. Swedish Health Board wants doctors to stop prescribing life-saving puberty blockers. A Swedish government agency has recommended that puberty blockers would be withheld from trans youth despite overwhelming evidence that the treatment is life-saving. There's not overwhelming evidence that the treatment is life-saving. The overwhelming evidence has shown that puberty blockers end up sterilizing them, which will also cause mental damage or psychological damage to kids more than actually just anything else. So, that being said, there's a lot of pushback to saying that it has more negative effects than actually positive effects. The National Board of Health and Welfare, also known as social listening, is Sweden's equivalent of the UK's NICE. It is responsible for issuing public health advice and its guideline inform, but does not necessarily dictate political practice. In New York guidelines employing puberty blockers, hormone, and therapy for trans youth, Puberty on Tuesdays by Socialist advised that blockers should only be prescribed in exceptional cases and claim their use is backed by uncertain science. Research into 2020 found that puberty blockers can be life-saving for trans youth, just drastically decreasing their chance of suicide, depression, and anxiety, which ends up being completely wrong. Former head of knowledge-based and policy ethics said that the agency was unable to draw any definite conclusions about the effect and the safety of puberty blockers based on scientific knowledge, and claimed that the risks outweigh the possible benefits. Only in so-called accidental cases should puberty blockers be given, he said. By psychosocial interventions, child psychiatric treatment, and suicide prevention measures should be provided by clinicians. Agreed. In Sweden, organizations commissioning and delivering services are expected to take the social listening recommendations into account when planning and providing health care. Clinicians are expected to be familiar with the advice and take it into account when exercising clinical judgment. It does not, however, override individual responsibility for what treatment is best for their patients. The guidelines also help decision makers allocate resources and formulate their own specific guidelines. This means that while social listening judgments play a big part in what healthcare is provided is available to Sweden's, eligible providers may supply alternatives to or tweak the guidelines to suit particular patients. Social reason also repeats all requests to change gender markers on identity documents in Sweden. So, as we can see here, they're saying Swedish Health Board cites junk science. Then it said that social reasoning officials have requested that the Swedish Agency for Health Technology Assessment, a healthcare watchdog, to provide with all relevant studies on the effect and safety of hormone treatments. When combing through the compiled research, SBU concluded that more research into puberty blockers must be done. This is despite puberty blockers already being well studied. A 21 study found their use helps trans teens feel happier, but it doesn't. Among the evidence that the cites is an American study vastly debunked as junk science by activists and healthcare professionals. So, what we have here is that a lot of people are trying to push this stuff onto specifically kids, and the reason why they're trying to push onto kids because kids are very influential, and they can be, groomed into something as of this. And of course, we're having every source of the media try to block this up and ban words such as groomer because they want kids to to do these sexual acts, or specifically do further medical research for the LGBTQ community. So I mean, it's all along. It's just a terrible, terrible thing, and it's a huge problem. The UK has officially decided to ban these things, and Europe has officially decided to ban these things, and I think America should follow suit. Alright guys, that's it for the video. Like, subscribe, share, and I'll see you in the next one. Take care.